Good morning, everybody. Welcome to another episode of Psyched Pod. I am Dr. T. Watts, business strategist and professor, and we also have Dr. Liz over here. She
Hi,
is
I'm Dr. Liz Dubois Erskine. I am an executive coach, a former professor that no longer wants to teach ever again in the adjunct system. We are Psyched Pod. We exist to have real conversations about the overlaps between mental health challenges and running businesses, running organizations, running the world. So if you are listening for the first time, we just give a quick disclaimer. Neither one of us are medical doctors. Please do not take anything that we're about to say as medical advice. These are our experiences. Our guests come on, they talk about their experiences. If you need support and help, call 988. We are here to support conversations. We are not here to tell you to take meds, get off your meds, go to the hospital, not go to the hospital, or any other crazy things. So with all of that out of the way, today we are talking about surviving the system, meaning the mental health system that exists ostensibly to make all of us do well. What are the nightmares that we have personally encountered and that we have heard about as we have gone through those experiences? So you're going to hear some deep and dark experiences. If you're not in a place to hear some of that, please take care of yourself. Go listen to one of our old episodes. Or if you are here and really excited to dig into a conversation about what not to do when treating mental health, you are in the right place. Ooh, baby. So with all that out of the way, Dr. T,
yes.
give me your top nightmare scenario that you have survived.
Ooh, jumping right in. Okay. So, just going to be completely transparent. When I was in the military, this was my first time ever. I ended up in the psych ward. I was having suicidal ideations. Things were really bad and pretty dark for me at the time. When I was there was a doctor. They were asking me a series of questions during intake, and there was one question that really had me reflect on like a whole bunch of things differently. She asked, "Have you ever been sexually assaulted?" And that was something I had to sit and think about. I was like, because for the longest time I kind of just buried it, pushed it away, didn't think about it, didn't want to think about it. And so after that, it was kind of just like a little light bulb went off, like, hey, like, that one simple question, that was the only time anyone ever asked me. That was the only other time I ever thought about it outside of the instance. And again, this is 2 years post that incident happening. So when I started thinking about it, I was like, okay. I get admitted, and I have to go to a crisis stabilization program after for a week. In that program, the desire for me to talk about it was just like a lot. So I'm just like, okay, like now I'm starting to realize, is this impairing my functioning? Like, is this something that bothered me? Like, I'm just kind of, the light bulb's going off. I'm getting some self-awareness about the situation. We don't have regular medical doctors in the Marine Corps. We have Navy corpsmen for doctors, which is other military personnel who is in the Navy. So I remember talking to a corpsman, and I really just wanted to share the experience because I was trying to get insight. Like, is this something that could have been like bothering me? Like, is this something that has affected me? Like, when she asked me, I didn't think about it. And, he listened, and immediately after, he was like, yeah, I don't think you're fit for duty. And I was like, what? Like, that just kind of, it wasn't the response that I was looking for, because I was looking for more like, helping me solve or work through that trauma and work through that scenario and work through that situation. And hey, is this why I'm acting like this now? Because I'm starting to realize. And his first instinct was like, yeah, we're going to push you out. And they actually did try. Like, there was paperwork and everything like that. And of course, at the time, I was problematic in my command because I was going through a hard time. And I don't want to say that the military doesn't care about you when you're going through things, but things are mission first. So if you're not able to fulfill the mission, I don't want to say you're useless, but yeah. So my command was very like, what's going on? If she needs to get pushed out, push her out, like get her out. And there was no empathy. Nobody knew what was going on because obviously there's HIPAA, you can't share medical information. And this dude was really making my life hell. And I was like, yeah, he was actually trying to push me out administratively. And In the Navy, an admin SEP might be okay, but in the Marine Corps, an admin SEP is kind of almost punitive. Like you don't.
What's an admin SEP for those of folks that
So
aren't?
an admin separation, you get separated out of the military. It could be for a myriad of issues. Like for instance, in the Marine Corps, we have extremely stringent standards in terms of height and weight standards. So if you're too far out of that and you're not able to alleviate that by going to BCP, which is a program that they send overweight Marines to, if you can't get that fixed, you will get pushed out administratively. Now, sometimes there's health conditions involved with that. So it can't necessarily be a punitive action, even though you are getting separated almost punitively in a sense, because it's like, you can't meet the height and weight standards. So this isn't a good reason you're getting pushed out per se. And then there's also some generalizations. Other branches, their admin steps work different. Like sometimes there's bad reasons people get separated, and it's classified as like an admin step, and it's general discharges. The reasons they vary, but essentially you didn't fulfill your contract, whatever the case may be. You're getting pushed out. Either you weren't fit to serve or the military wasn't a suitable place for you, which is really the bottom line. So again, in the Marine Corps, there's really no good admin set, in my opinion, and that's kind of just the stigma a little bit. And so yeah, I was they were pushing to kind of separate me, and it was a really big deal at the time because apparently you're not even supposed to get kicked out for those reasons. So it was just one of the lowest times for me and the hardest times, because not only was I coping with that situation and kind of reliving it and understanding it again, it's just kind of like now there's also this negative stigma because my livelihood is on the line, because now you guys are essentially saying I'm not fit. I've been fit this whole time. I was going downhill mentally, but I've been serving, I've been fulfilling these things, and because I came out and I told you guys this, now you're kicking me out. So that was a time for me. That was probably, I think that gets the number one spot, because that was one of the lowest moments in my life that I can remember. One of them, there's two, but that was one of them.
Oof, oof, oof. Thank you for your service.
Thank you.
I hate that happened. I'm so not surprised, though. I'm so not surprised. In my master's degree, like a huge focus of my research was sexual violence in the military against women specifically. I don't want to imply that men don't experience this sometimes too. It was wild to me how much the victims were penalized for the experiences that they had, right? And I think that as someone that works with a lot of people with PTSD, I think that there's some legitimacy to saying you're not in a good place right now to do your job. But the follow-up to that is, so we're going to help you get to a better place, not so see you later, toodaloo, buckaroo. And I remember when I pushed my rape down. I've been raped twice. I pushed the incident that I'd experienced in my teenage years down. And when I was about 24, it all hit me. I had lost a lot of weight and I got hit on by a mentor, and it was just like, ugh. I realized that so much of my weight gain had been about not having a body for people and men specifically to be attracted to. And so once I did, right, I was 20 years younger, I was modeling, I was like hot little number, and to have a man like show interest in that felt very, very scary to me. And I had like what's probably best described as a breakdown, and I walked into my office the next, I don't know, day or two. It was Super Bowl weekend that all kind of came crashing down. And the Monday after, I walked into my office and I had an amazing boss. And he said, I don't know what's up with you, but you need to leave. Right. And he didn't say it in a way that was like, screw you, get out. He said it. He was like, I don't know what's going on, but you need to go take care of yourself. Come back in 2 weeks. And like, no questions asked. I was given like paid leave. See you later, alligator. And I went to therapy like 3 times a week for those 2 weeks. And then I had an iPod, right? This was a little bit back in the day. And I had an iPod. I lived in Washington, D.C., and I just went to a bunch of art museums and I listened to the same song on repeat, Here Comes the Sun, over and over and over again, and like looked at art and just cried for like 2 weeks straight. And I was absolutely not fit to go and do my job whatsoever. But the way that that was handled was with a lot of gentleness, and like nobody asked what's going on with you. They just said, you're clearly not yourself, and like go take care of yourself until you are. And like with the military, obviously, like we have to have an awareness of whether or not someone's okay, right? Like, or else a lot of really bad stuff could happen. But the follow-up to that is compassion and treatment, right? Like PTSD related to sexual violence is not like this mythical, like, golly jeepers, how do we help? Like, there's really, really good research that tells us exactly how to support someone going through that. And the fact that that's not provided, especially to women in the military, it's just absolutely infuriating. And like the part of me that's like, as a taxpayer, I want my taxes to support military members that are like struggling so they can go back to being, in a good place and they are fit to serve. So what a nightmare scenario. I'm sorry you went through that.
Yeah. I mean, we're past it now, but what is your number one kind of nightmare scenario that comes up when you think about it? Like,
oh my God, it's like so easy. It's so easy. So I also spent some time in the hospital getting stabilized on meds. I call it mental health summer camp because that's what feels like comfortable for me to like acknowledge that I had to take some time out of my life and really just like take a pause and go take care of myself and learn more about who I am. And in the process of that, I learned that like mental health summer camp does not really do anything beyond like stabilize you. And for me, I needed to have my meds adjusted. And so that was the purpose of me being there. But while I was in mental health summer camp, there were like 3 very specific things where I was like, oh my God, this caused so many problems. The thing that caused the most problems was that I was prescribed a drug that was an off-label use, which is fine. There's lots of medications. I take 2 medications that are off-label use for bipolar disorder, off-label use. But this one in particular, gabapentin, was like, had a ton of side effects. And so here I am, I have no advocate with me, no parent, no friend, no husband, no nobody, nobody is in there with me. And I'm sitting across a table with like 3 different doctors and they're all saying, this is the right medication to take. I don't have access to a computer. I don't have my phone, right? I don't have any pamphlets being like, these are the potential side effects. I was just told you need to take this medication and you're going to get better. And I'm like, great, bring it on. And that medication made me extremely sick. Oop, here I am. I don't know where T went. So so that medication made me really, really, really sick to the point that 10 weeks later, I was like, I have to get off this medication. I need to go back to summer camp because like, this is killing me. So that was the first thing, was just being like tremendously disempowered and having medication, like, I don't want to say forced, but like pushed upon me, right? And like you had to like show that you took the medication. This wasn't a thing where it's like, well, I'm uncomfortable with this. It's like, here's your meds and you're going to freaking take them.
Yeah. Let's watch.
Yeah, let's watch. Right. And so that was the first thing, was just like being given a treatment that made me much more ill. Like that was like the first nightmare scenario. And then also the same hospital, I was overweight at the time. Or I should say at an unhealthy weight. Who's to say it's overweight or underweight? But so I'm at an unhealthy weight. And this nurse who I like really had felt connected to, and this was someone that like was helping me feel better and giving me tools and resources and all this different stuff. She said to me, she like comes like to me, I don't even remember the context, and she goes, like patting my arm, and she's like, when you get out, you can just drink apple cider vinegar and then you'll lose all your weight. And I was like, lady, like, this is not why I'm here. Like, Read the room, girl. Like, this is,
Oh my God.
we're not here for the weight loss trip. Like, we're here to get like stable and comfortable and go home and parent and run our company. Like, this is not the agenda today, is the lose weight conversation. And like, especially not a like remedy that really doesn't have much to do with weight loss. So that was like the second thing there. And then the third, and this was my favorite, same nurse, favorite in terms of like, are you kidding me? So I'd like taken my medication. I was really upset, right? I was away from my son. I was doing things that I didn't want to be doing. I was taking medications that I didn't have access to research. Like, this was not stuff that I was thrilled to be doing. I was very upset about the whole situation. And she was just talking to me and being kind. And she again pats me on the arm and she goes, "Well, once you accept Jesus Christ as your savior, you won't take any of these you won't have to take any of these medications anymore." Like, I grew up in the church. I identified as a Christian for many, many, many years. And I was just like, what are you talking about? Like, I'm here at this hospital to get medication to help me feel better. And you're telling me that the thing that I need to do is to like follow a particular religion to feel better. And then I won't have to take the medication that you just made me take. And so like, whenever I think about just like how disempowering and scary those experiences are for patients, like those are the three that come to mind where I'm just like, oi, 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 oi. So those are my nightmares.
Wow. Well, thank you for your transparency with that. And with you saying that, just them giving the medications like without really telling you, that brings me to one of my own nightmare scenarios.
The
Another
floor is yours.
So there was and this one was kind of like, I still haven't put the pieces together with it because it's just still like so outlandish. But I told you about the first time about me ended up in the hospital in the military. It's only been 2 times, but the second time was shortly after I separated from the military. It was about July, August, September, October, 5 months later, and I was about 3 months postpartum. And so there's a lot of happenings and there was a lot of things going on, and I wasn't acknowledging, but it just got to a point where, I wasn't here. Like, I wasn't functioning. And
Mhm.
so my husband, he had to call, like, he called the hospital and they came to get me and everything like that. But I was just, I was no good. And
Mhm.
so with me getting there, I couldn't tell you what medications they were giving me. I do not remember the first week of me being there. They could have been giving me horse tranquilizers for all I know.
Mhm.
But I remember probably like the first day I was just in and out of consciousness, and like, they were just like, what's going on? They're running tests and they're trying to talk to me. But I think they had no awareness of what was going on. Like, they didn't know who I was. They didn't know my history. They didn't know my background. This is my first time ending up in the hospital. So I'm essentially almost a Jane Doe. And they logged me as such. Like, I remember when I went to go back to get my hospital records, I couldn't even get them. And I'm like, what's going on? And it's because they had me in their system as a Jane Doe. And that also made the whole process difficult for my husband to even talk to me because they wouldn't communicate with him with what was happening with me. And he was the one that called them. And essentially, like, when you're listed as a Jane Doe, from what I've learned, they usually do that for patients that they assume or think may be in a domestic situation, and so they will not and cannot release any information to anyone, in regards to you. But I feel like that's also a very bad thing because my husband was keeping he came to see me every day and he was keeping track of what was going on with me. And there were certain things, like, they weren't telling him what meds they were giving me. They weren't like And so that whole situation was just like a nightmare scenario. I still couldn't tell you what medicines they gave me. I started to come back to my senses in terms of like remembering who I was, where I was, what's my name, how to write my name, and stuff like that a week later. So that was my one of my other nightmare scenarios.
Mm. Mm-mm-mm. Hang on, we've got some feedback. Did your coat slip over your microphone?
Oh, Can you hear me now?
Yep, perfect.
Okay.
The fun of going live. For those of you watching, we're doing this live because we want this to be a really raw conversation, not one that's sanitized and made to be about work-life balance or self-care. Those things are absolutely important, but most of the podcasts out there that talk about mental health are actually talking about those things and not explicitly talking about mental health challenges. So if you're tuning in and you're seeing like little glitches here and there about microphones and whatnot, welcome to the party. We're doing this live on purpose, so we appreciate you hanging in for the little minor technical details.
Yes.
So as you're saying this, oh God, I'm so sorry I went through that. I'm remembering specifically. So the second time that I went to mental health summer camp, I was like, I was there specifically because they had screwed up my meds the time before. Like I was not there I was not having an episode or anything like that. They had screwed up my meds, and gabapentin had really screwed over my life. And I was like, I am not leaving this hospital until you put lithium in my system. I do not care how long I have to be here until you give me those pills. I'm not leaving. And that was really like a turning point in my life. So anyway, so I had this roommate, and she was also in the military, also a woman of color, also a mom. And she was not interested in the agenda that they had for her. She was just like not having it. If you spoke with her, she was lucid, right? Like for those of you that have never encountered someone that spent time in the hospital, like most of the people there are not like cuckoo for Cocoa Puffs, like not like able to like people seem normal. They're just struggling with severe depression or severe mania. In general, I don't want to say that's completely always the case. But like the first time that I went, most of the women there were high performers. One woman was like the curator of all of a major hotel like chains art. So like if you've been in any of these hotels, she was the person that had picked out the art. And like these are incredible, like hip and with it people that like every single one of those women was having a nervous breakdown from doing too much, right? They were not there like chewing on the walls or anything, like they were struggling. So this lady, not chewing on the walls, not kicking down doors, like she was a mom that was doing too much, and she wasn't taking the medication. And like I'm sitting like, kind of like a dorm room, like I'm like 9 feet from this lady in my bed and she's in hers, and they bring in a bunch of orderlies, like nurse techs, and they hold this lady down in front of me, like violating any privacy that she had, pull her pants over her tush, and stick a needle in her ass to like give her the medication that they felt that she needed to have. And like any aspect of consent like didn't exist. Like it was just not a thing. And like honestly, like I don't talk openly about my politics, but my politics changed in that moment around like individual rights. I was just like, this is like in this very moment, everything I believe to be true about certain things has been like ripped apart. I just like cannot see the world through the same lens that I did 37 seconds ago. And like as someone watching it, it was one of the scariest, like who holds down a mom, right? Like she was not a big woman. Like who does that, right? And this hospital does that, right? And I assume we're talking about surviving the system. I assume this is not the only hospital that has ever done this thing, right? Mm-hmm. And so just like as someone in the room seeing it, it was profoundly traumatic. And so I can't imagine what this experience was like for this woman herself, right? And oh gosh, like I'm sure there is like a space and a place where that needs to happen, right? If you have someone like totally like unable to participate in life, unable to be aware. Like there was a woman in the same hospital who I interacted with several times who was totally with it and totally fine until she wasn't. And then she was like panicking because she had like an international like press like interview and she had to get ready to meet the president and all this stuff. Like this woman didn't know what was going on in her life. She didn't know what was going on in the world. And those people, perhaps like that's the place and the space for like this kind of level of intense like medical intervention where someone's being held down against their will. From the outside, right, as someone that wasn't the doctor, someone wasn't the nurse, who was not in the know about this lady's situation beyond what she had shared with me. That was nuts. It was like such a wild, like invasive, violent way to help someone. Um, ugh, yeah. I mean, that moment, like, profoundly changed my life. It changed what I believe about certain things in terms of human rights. And I don't know. That's all I have to say about that, to quote Forrest Gump.
Yeah, it's not easy at all. Like when when you're dealing with certain things, and sometimes it just takes like the right questions, like
Mm,
probing questions. Like the first time I was hospitalized, they asked the right question for me to even begin to do some inward reflecting.
mm,
'Cause I tried to go. I tried to keep going. I tried to bury it. I tried to just go, go, go. And that was affecting me negatively. Until I did get to a breaking point to where, if you don't deal with your problems are going to deal with you.
amen.
And so they were dealing with me. So, but when it comes to that, it's hard because I guess I do understand, if someone is combative and they're you have to use excessive force. But also me, like there's a lot of times where I look at excessive force very differently because I'm just like um there's a lot of I can personally tactically I feel like I can eyeball something or someone and be like, okay, that wasn't necessary. Like, you don't have to use deadly force. You could have done this, or you don't have to use excessive force. That's a young lady who's 100 pounds. There's no need. But I'm not sure, they're dealing with certain things on a day by day basis as well, just kind of like cops, like they're dealing with this same situation. So I don't know if they're numb to certain things and certain factors, or if they're just not looking at it like that, or potentially they're privy to things that we don't know, like this is how bad it could potentially get with this 100-pound patient, but you have no idea. you know you don't know these things, but I can say from like my experience, it did not benefit me to be tranquilized and stuff like that, and absolutely have completely be disoriented. I was disoriented for a week. I remember leaving the hospital and I was off balance. I was like, the world is like literally off balance for me. There's something going on. And so and almost felt like kind of like a guinea pig. Like there was just,
mhm,
know what medicines are going to work or destabilize or stabilize you or whatever, and they don't know what medicines can destabilize you and make you worse and put you in a worse mental state.
amen.
So, and I will say one thing that I haven't talked about, but what really helped me get through all of those events was my faith. That was literally the only thing that got me through because I couldn't remember anything else. But I did remember God, and I remembered my husband. He came every day and he supported me through that. But things were just, with I feel like the medicines that they gave me definitely made things worse. Because like I said, at one point I had a recollection. I was oriented to like, okay, I knew where I was, but after that I was completely disoriented. I wasn't even able to write my name. And
Mm.
also had the Mirena. That was also
Oh, the birth control.
yeah. Mhm.
Yeah. Yeah, birth control has such an impact on mood, and it's not talked about. Yeah, I was just with a friend who was switching up her birth control, and it never ever came out of the doctor's mouth uh ever about moods. I brought it up as a question, and it's bonkers to me, like how, I'm so blessed. I have the world's best nurse practitioner. She's my like doctor person. um but like, all nobody talks about like moods and interactions or anything like that. Like when I'm with a general practitioner or a specialist and they want to give me medication of any variety, I'm like, so here's my history with medication and mood disorder and like what's going to happen there. But yeah, I love that you brought up faith, because I do think that you have to have some, I guess faith is a fair word even for me, right? I'm not religious, but I would say pretty deeply spiritual. I've been in 12-step programs for almost 20 years, and really have a sense that like I'm not the biggest thing in the universe, right? There's something bigger than me that has my back to some extent. And I gosh, just like holding on to the sense that like this is just a chapter in my life, not the whole book. And like for me, having faith in that, right? Like you and I you have a much stronger and more solidified idea of a higher power. Um, but I did have a sense that like this wasn't the end. This wasn't the only thing that was gonna happen. Um, but for a while, especially when I was coming off the gabapentin, um, so I went into the hospital after being prescribed this drug that really harmed me. I was there for a week getting stabilized. I had said until I'm on this medication that a therapist had recommended, I'm not leaving and you guys can screw off. And then after that, I decided to go to a mental health rehab for a month to be monitored while I was getting onto this medication, because I didn't want to have like the same experience of like trying something and then getting very sick and like having to get acute care versus like be under the supervision of a doctor. So I'm in this place and I was so depressed. I like couldn't believe that my life was in this place where like I had to like have all this medication and like have all of this support that really like didn't feel like support. It felt like bullshit. And I didn't want to be alive anymore, but I wanted to stay alive because I had a child, right? I still have a child. And I like I wasn't going to leave him. I wasn't going to leave him, and I wasn't going to put him through the experience of being a child and having your mom kill themselves, right? And so I knew I had to stay alive, but I didn't want to, and I didn't know how I was going to like function. And I remember we went and saw like a movie. We had like an outing. We went and saw like Ghostbusters or something. And I didn't think about how depressed I was for the whole like 2.5 hour movie. And I thought to myself, like, I can just like get through the rest of my life, like watching movies and like just kind of like fast forward through all of these like life experiences. And that in and of itself was just like a devastating thought. Like in general, like I'm an extremely like exuberant, happy, just like alive person. And I was the opposite of that. Right. And so we're like sitting in like group therapy or whatever. And I just didn't want to be alive anymore. And I had no idea how I was going to get through the next X number of years. And I remember I said to this therapist, to ask your point about asking good questions, right? I said, what if I'm like this for the rest of my life? And she looked at me, same intensity. And she goes, well, what if you're not? And like asking that like right question, like kind of broke it open a little bit, where I was like, I'm not trapped in what felt like very sound analysis at the time. I was like, well, I just need to do like some planning here to really figure out like how I'm going to get through the next X number of years. Like I need to just kind of like game this out, have an outline, like have a, I'm a big fan of a strategic plan. Like how am I going to stay alive and get through it? And having that kind of thinking reflected back to me by people who were also in such a bad place, it felt very healthy and normal and like logical to think about how do I get through the rest of my life being this depressed, and having a practitioner just be like, I'm gonna call you out for having that thought. Not call me out. I'm gonna call that thought out and say like, but what if it's not that way? That question, this was many, many years ago at this point. And that question also changed my life, right? Where I was just like, oh, right. Like, just because something feels logical to me when I'm in a state of like severe depression doesn't mean it's actually real, right? And so like when I hear people say like your feelings are valid, like, no, they're not. Like they might be coming from a place of like this feels real. Your feelings aren't valid. They're grounded in a bunch of nonsense that are telling you that
That's
like,
true.
yeah, right. And like
Sometimes some things are justified, but then there's other
Oh, of
times
course.
where, like, let's say a traumatic event is now changing your anatomy essentially on how you even.
100%.
And so, yes, some things aren't valid because you're reading into the situation completely differently now. And so, help should feel stabilizing and not
Mm.
stabilizing. And so, what are some of your thoughts on providers who don't really listen to what you're saying? Because, you know, I think that there's those providers that ask questions, and they're asking those questions and they're probing and they're trying to get insight. You'd probably be more willing to talk, but then there's providers like you're telling them and they're just like, and so we're going to get the gabapentin and we're going to get 7,000 milligrams since the 200 wasn't
Right, we're
doing
just gonna carpet bomb your frontal lobe. I bet it'll work.
it. What are your thoughts on that, like providers who don't listen?
Okay, so I had another nightmare experience. So when I was 24, I was coming out of this experience of having kind of suppressed the valid feelings I was raped when I was 15, right? Of having been raped. I'd like pushed this down for a long time using different like coping mechanisms, specifically like binging food and drinking a lot of alcohol. And so I come out of this, I'm like sober, bright-eyed, bushy-tailed, but like having all of these feelings for the first time ever. And so I went to a therapist who was a highly recommended therapist. She was a little bit of an older woman. And she's like, well, walk me through exactly what happened. And exactly what happened to me is like textbook date rape. If you open the book that says date rape, there was a picture of this experience. And so I walk her through this and she looks at me, she's taking notes and she goes, if we were in a different culture, all of your aunties would just tell you that that's just what boys do. And I was like, yeah.
What do you mean by that, miss?
Yeah, she's just like, it just, boys are just kind of rapey when it comes down to it. And I was like, what are you talking about? Like, what are you talking about? Like, I have dated many, well, maybe not many at that point, right? I'd been in a monogamous relationship for like 5 years at that point. But I've gone on a couple dates and they've managed not to rape me. And so it was just like this absolutely bizarre statement of like, okay, well, we're not in a different culture. Let's assume that that is true, because I'm have no doubt that there are horribly repressive cultures where a woman who'd been date raped would be told that that's boys will be boys. That's not our culture, hopefully. So what do
Well,
you
I don't know.
like actually?
Put into society.
Right, and how awful for men, right? Like I'm raising a boy, I'm married to a boy. Like how awful for men that you would like chalk this up to, well, that's just what men do. Like, no, it's not. But for this practitioner, like she felt, 100% comfortable being like, oh, hey, well, that's probably just a thing that happens when boys are around girls. And I was like, maybe you should go really never practice therapy. Like you should just never be a therapist ever again. So that was like, I think, how about you? Same question.
That reminded me of a scenario. And I'm going to literally tell you what I heard. I was watching this video. There's this viral video on Instagram. This guy, he's like, I don't know if he's a professional UFC fighter or a boxer, but he's like on the microphone with the interviewer. And I guess the guy must have asked him, like, why'd you start boxing or whatever. And he was like, as a child, I was molested and raped. And the interviewer says, well, and it was, you could tell it was on accident, but he says, well, you must have been an attractive, and so that, like, and so we're just like, attractive, and he's like,
Oh
what?
my God, what the fudge
And
is
so
wrong with people?
it's kind of like, this is not the normal, this is not the standard, and we can't.
No. I have an amazing therapist. I have my psychiatrist I met in that rehab that was nonsense and bullshit for the most part. I had met that therapist and she was brilliant, and I met my current psychiatrist who is also quite brilliant. And so I don't want to say like everybody's bad. They're not, right? Like I have an amazing therapist. But yeah, there sure are people that really need to go work at Target because that is
And
like,
so these people do exist. And so like when you say that, that's exactly what that reminded me of, except you literally gasp when you hear that because you're like, what the?
I
But
know. Like, what
it
a charming thing. Like there are things as a boy mom, right? I'm sure girl moms have different things, but like as the mother of an 11-year-old boy, there are like some times where I'm just like, I'm gonna end up in jail if I ever encounter the person. Like if someone ever said that to my son, I would be in jail.
yeah, and it's these things happen. They happen to everyone, right? I don't want to generalize any stigmas and make it seem like this is only happening to women. It happens to men too.
Right.
But we have to be very conscious to, be conscious of what we're saying, how we're making people feel. I was just doing like a sexual harassment course,
Mhm.
and you'd be surprised to know sexual harassment isn't necessarily what you do, it is how that person is impacted by what
Huh.
you hmm and it's kind of it's a crazy thing to think about, but you would definitely change a lot of things if you knew this is what, even if this is my intent, like people got to be more conscious of, like, intent, impact. You might have
Yeah.
intended.
Oh, but that's so hard. Like, how do you do that without walking around in the world overthinking about what you might
True. It's true. And it's hard. Like I said, that surprised me. That's something I literally just learned in this course that I was taking, because we've got to be up to date.
I would say that's one professor's opinion because I would go toe to toe and say something different.
Yes. Well, that is now in the course, in the curriculum that they are making everybody um listen to and learn. And so it is a little bit wild, but that's kind of, that's at least where this place is at,
Yeah.
where I was taking this course. And so to think that, how somebody is impacted by what you said can be classified as this. And and I could see both sides to it, because I can see if someone who has never had any, like, if this is their normal and this is their standard, like the guy who said, hey, maybe you were an attractive child. He thinks that's okay. So, he had no negative and ill intent. He thinks that's
No, of
okay.
course not.
And then, but then there are people, maybe they are, it's a harmless joke, but because you were impacted in that way, now it's this. And so I think what it calls for is just for people to be, take 10 more seconds to think about.
Oh yeah. Yeah. Well, in time and place, right? Like I'm part of a networking group, an in-person networking group, and it was brought to my attention that someone had said something wildly inappropriate. And I then ran into to the same person in a different venue. And had they said the same thing, it would have been freaking hilarious. Right. And so I think there's like an aspect of like boundaries are not fluid, but like behavioral expectations are. And there's like a real read the room. Like my context for like what sexual harassment is, if I'm at a business setting, is very, very different than harmless flirting if I'm, in a social setting, right? Like one of those things is, same flirt, right? Like we could say it's the same behavior, right? Like, but it's a different context. And so I don't know, like I think it's so easy to get into like overthink. And
Yeah.
so it's like you said, like take 10 more seconds and like, would it make your mom grossed out? Like that's just like really good. Like if your mom saw you doing it, would she be ashamed to be your
Could you
mother?
say this in front of everybody? Could you
Right,
say this in front of the CEO? Could you
right.
say this in front of the E9, in front of the officer of the day? Could you say these things? If you cannot, if it's something that you know that anyone besides this person you're saying to would probably be like, maybe don't say it.
Yeah, maybe don't say it, Yeah. Yeah. Post it on the community board in FetLife, not in your office break room. Thank you. Okay. So let's bring it on home. What advice do you have for practitioners, therapists, doctors, hospital nurses? What advice do you have for practitioners to not screw it up?
Um, really give a damn and care about the patient.
Mm-hmm.
I feel like in the line of work of healthcare, you have to be empathetic, to some degree. You have to have like these days, I know a lot of people go into nursing because it makes a pretty good amount of money, but this is not a money driven field. I feel like if you're drawn to healthcare, you really want to help people. And if you're there to help somebody, you should be listening. You should be conscious of the things that they're saying to you. You should be trying to look for other stuff. Like that one time I was in the hospital, they had no background on me. They didn't even question any background on me. They didn't even know I was a veteran until like the second week that my, husband told them. And that played a big part in my history. And
Yeah.
so just understanding the patient, getting to know the patient history, doing your due diligence, like, okay, how. And I know you're busy and they're probably far and few in between, but you gotta care. You've gotta care about what you're doing, the work you do every day, because people, they're really going through things, and you could be the difference between a traumatic experience and the help that somebody gets.
Yeah.
How about you? What are some of the things that you would want for to like listen to and or do better?
Yeah, I think that there's like two things specifically. One is like much better, like patient empowerment and education around the medications that are being given, right? Like maybe you're not lucid and you have to, force somebody to take a medication, right? I don't know. I'm not a medical doctor. I'm not there, whatever, right? But I've had enough experiences where I've been handed pills and just told like just take this, and I think that there's a really dangerous precedent in that, because once someone leaves acute care or once someone is feeling better, they have to know what they're putting in their body enough to be able to watch out for side effects, right? And like that was not a thing that was done for me when I was given gabapentin. And I'm not saying like that drug specifically is a nightmare. I'm saying people's bodies react to different things, and if you're not given a lot of information and consent to taking the thing that you are being given, you are not a patient, you are captive, right? And like allowing someone to have agency and be empowered is the difference between someone needing to stay in acute care and having the capacity to lead a full life. So that's the first thing, is like much better communication and education and respect between boundaries and patients, specifically about medications and side effects. And then the second thing, this I think is like influenced by my experience more than anything, because it's kind of a niche thing to say. If you're a practitioner, like unless you are doing faith-based counseling, don't bring up someone's religion unless they ask, right? Feel free to say, are you a person of faith? Would you like that to be part of your treatment, right? If
I
that's
thought that's what they were supposed to be doing.
right, exactly, right. And like even if you're at a religious hospital, like recognizing that people are in that hospital because that's where they were placed, not because they necessarily like subscribe to your like flavor of religion. And so I think, like you said, T, like asking really good questions. One of those questions is, are you comfortable talking about faith? Would that help you feel better? I think that that's a super powerful question, because a lot of people are going to say yes, right? Bring it on if that's something you want, but understand that there needs to be consent involved in that, because that is not medical care, that is religious care. And we can have a conversation about whether or not there's overlap there. I think a lot of people would say yes, but again, like if you're in acute care, you don't get to leave. And if someone says to you something that makes you uncomfortable or really crosses a boundary for you, you don't have a choice where you get to say, you know what, I'm gonna walk away from this conversation now. Like you don't have that liberty. And so to push that on someone who's in such a vulnerable state, I think is just really wildly inappropriate. So those are my two big ones.
Okay.
Do you have any final thoughts?
Any final thoughts? No, I think we hit a lot of things per usual. This was a super good conversation. I feel like we were really transparent and very vulnerable in some of the things that we said today. So, yeah.
Excellent. I think I covered all my final thoughts. So with that, I think we'll sign off. Yeah, we good to sign off?
Yes. All right. We'll see you guys next week.
Okay, if you want to email us, we are at psychedpod@gmail.com. That's PSYCHED pod@gmail.com. You can also go to psychedpod.com or at gmail.com. Sorry. You can also go to our website at psychedpod.com, and we will have the link to apply to be a guest up there should you want to come and party with us here live.
Yes. All right. Well, we will see you guys next week.
Toodaloo. Bye.